So, triangular or quadrangular area. Why this area is called dangerous area of the face? Why this area is dangerous? If you have a pimple here and if you want to remove it with your fingers or the nails or anything, that is dangerous. Or any cut over this area is dangerous, is considered as dangerous area. Why? Anatomy is a subject where you cannot cook up any story. Either you have to know the exact fact. Okay. In the question answer papers, I get several stories. Okay, they actually kill their time. Fellow friends are writing, I should also write. So, for your dignity, to maintain your dignity, you are also writing, but you are writing some stories. No. Why this area is called dangerous area? Why? Again, I told you, no cooking of story. Why this area is called dangerous area? Yes, because cavernous sinus through facial vein. The facial vein is this is a tributary of the facial vein, this area. The tributaries of facial vein drains here from this area. And there is a communication between the facial vein. The facial vein starts as the angular vein. When it goes below the angle of the lip, it becomes the facial vein. It is called as facial vein. As a whole, it is starting from here. It is the part of the facial vein is called also called that is angular vein. So they have got communication here. That is superior ophthalmic vein, inferior ophthalmic vein is there within the orbit. And through superior and inferior ophthalmic vein, it is connected with cavernous venous sinus. Cavernous venous sinus is, you can see in the base of the skull. Base of the skull here, there is a position of the, here you will get the position of the cavernous venous sinus. And that sinus is very important, that if there is an infection, it can give rise to so many things, the affection of the cranial nerves, second, third, fourth, fifth, part of the fifth, sixth, all the nerves, they are in relation to the lateral wall of the cavernous sinus. Patient will have hectic temperature, continuously rising temperature. And we know there is the mastoid region. Mastoid antrum is there, and through that mastoid antrum, the infection can reach the cavernous sinus. It can reach through the tributary of the facial vein, it can reach. And there is a life-threatening condition, that is a cavernous vein thrombosis, which is called. Cavernous venous thrombosis, that is called. So, this is dangerous area. Number one point, that is the communication with the dural venous sinuses, that is cavernous sinus. And any other point, why it is dangerous? The vein has got no valve. So it can go in the forward direction and it can go in the backward direction. There is retrograde flow of blood can take place, and blood can reach if in opposite direction. It can reach through these veins and can reach there. So this vein has got no valve. The blood can move in either way. Next, another point which is common for the face. Yes, there is no deep fascia in the face. Facial artery, what is the origin of the facial artery? From where it originates? Sometimes we should have some idea from where it is originating. It is aorta, carotid artery, common carotid artery, external, fumbling, external carotid artery. At what level? At the level of hyoid bone, the greater corner of the hyoid bone. Okay. What are the other branches of external carotid artery? Have I mentioned the branches in my class? Have I mentioned or not? The other branches of external carotid artery? এই শরীর খারাপ লাগছে? ঠিক আছে, খারাপ লাগে চলে যাও কিন্তু হ্যাঁ। আর what are the other branches of the external carotid artery? তুমি বলো। Superior thyroid artery, one. Next, মনে রাখতে হবে তো। Lingual artery, কে বললে? Very good, lingual artery. Maxillary artery, occipital artery, occipital region, it will reach the occipital region. Posterior auricular artery, behind here, posterior auricular artery, and behind the ear there is posterior auricular artery, and another artery which will supply this occipital region, occipital artery. Superficial temporal artery, you can get in front of the tragus. Actually, the terminal branch is the superficial temporal and maxillary artery. Superficial temporal and maxillary artery. Okay. What are the branches of the facial nerve? Bolo. The extracranial part of the facial nerve. What are the branches? বলো 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 কি জোরে বলো, দাঁড়িয়ে বলো, ওরা শুনুক, ওরা শুনুক শুনুক সবাই, ওর মুখটা দেখুক, বলো একটা করে। ম্যান্ডিবুলার অ্যান্ড সার্ভাইকাল ব্রাঞ্চ। কেন এটা বলতে পারছো না? the extracranial, because it has got neural cords, then it enters into the cranium, intracranial part, and when it comes out through the stylomastoid foramen of the temporal bone, this is the extracranial part of the temporal of the facial nerve. And from the extracranial part also we can get one nerve which is going behind, posterior auricular nerve. One nerve is coming out because here is a situation of the stylomastoid foramen, and from here it will reach the parotid gland. It will enter into the parotid gland, and within the parotid gland it will give some branches, these 5 branches. Before that means exit from the stylomastoid foramen and entry into the parotid gland, it gives one branch which passes behind the ear, that is the posterior auricular nerve. And another nerve goes below and supplies the neck muscle, posterior belly of the digastric and stylohyoid muscle. Posterior belly of the digastric and stylohyoid. So one branch will supply this area posterior to the ear, that is the posterior auricular branch, and one branch will go below and it will supply the posterior belly of the digastric muscle and stylohyoid muscle. That means styloid process, from the styloid process of the temporal bone to hyoid bone, one muscle, that is the stylohyoid muscle. There is one muscle which is from here, it is up to the mastoid process of the temporal bone, which is called digastric muscle, which has got anterior belly, which has got posterior belly. Posterior belly is supplied by the facial nerve, whereas the anterior belly is supplied by the mandibular nerve. Because the anterior belly is a muscle of the first branchial arch, whereas the posterior belly is coming from the myotome of the second branchial arch. So the nerve supply is facial. So the same muscle which has got 2 bellies, one is anterior belly, one is posterior belly, and in between there is a central tendon. Okay. Anterior belly, the nerve supply is different, posterior belly, the nerve supply is different. Anterior belly is supplied by the mandibular nerve, mandibular division of the trigeminal nerve. Nerve to mylohyoid, which also supplies this anterior belly, whereas the posterior belly, from central tendon to the mastoid process of the temporal bone, that is the posterior belly which is supplied by this facial nerve. So facial nerve not only gives 5 branches, but before that, before entrance into the parotid gland, it also gives 2 branches. One is posterior auricular and another nerve which supplies the posterior belly and of the digastric and stylohyoid muscle. From styloid process of temporal bone to hyoid bone, so stylohyoid muscle. What is Bell's palsy? What is Bell's palsy? Your name? Anjali. Bolo. Tell me, what is Bell's palsy? When extracranial part, hey chale, bolo, what is Bell's palsy? Why? The affection of facial nerve, that more specifically affection of the extra-cranial part of the facial nerve on any side, right side or left side. When the facial nerve of one side, the extra-cranial part of the facial nerve of one side is affected, or it may affect the other side also, it is called. What are the features of Bell's palsy? তোমার পিছনে যে আছে এই মেয়েটি ওইদিকে লুকিয়ে আছো তুমি 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 ইয়েস হোয়াট আর দ্য ফিচার্স অফ দ্য বেলস পলসি তুমি বসো তোমাকে ডাকিনি আই জোরে বলো না শুনতে পাচ্ছেন eyes cannot be closed. Why? Because কি levator palpebrae superioris. Levator palpebrae superioris is for opening. এই তুমি কি কেন বলছো তোমাকে জিজ্ঞেস করেছি orbicularis oculi cannot contract. Why? Which division of the facial nerve supplies there? Zygomatic branch. And also the upper buccal branch, superficial buccal branch of the facial nerve supplies here. So eyes cannot close. Other things, no wrinkle. Wrinkle is produced by the occipitalis muscle, frontal belly of the fronto-occipitalis. Okay. Next. Huh? Smile. Smile. It is deviated to the sound side. If there is a affection of the facial nerve of this right side, this will be the feature. And patient cannot articulate. He cannot articulate. Why? Articulation is the sound production. Voice production is also held by this orbicularis oris. So if one side is affected, the patient cannot talk properly. This will be the feature. Opening. You can find this type of person. So it will get deviated to the sound side. Continuous salivation. Because Vasculature muscle is affected. Here we can find actually what is the function of the vasculature? It compresses the cheek against the gum. So collection of the food particles within the vestibule of the mouth. Cannot chew properly. No furrowing. There is one muscle, corrugator superciliaris, which causes the furrowing or development of furrowing. When we are disgusted, we can develop this furrowing. This is due to the contraction of the corrugator superciliaris muscle, and this is the frontal is caused by this transverse wrinkles are caused by the frontal belly of occipital frontalis. So there will be mask face of one side. Okay, that is no wrinkle, transverse wrinkle, no development of furrowing, no movement of this. When patient is asked to blow, there will be blowing on, we can see puffiness on this, puffing of this side, but here there will be no development of puffing, because the Vasculature muscle cannot whistle properly, cannot puff his cheeks. Continuous lacrimation, why? Eyes cannot get closed. Even during sleep, you can see the person like will remain like this. So there will be an exposure, keratitis, the cornea will get dried, and so from the lacrimal gland it will try to overactive, so that continuous lacrimation. Marcus Gunn phenomena. While eating, eyes will get closed. Why? There is a faulty generation between the fibers which are supplying the, because after the degeneration of the nerve, there will be regeneration, but there will be a faulty regeneration. That means the fiber supplying the orbicularis oris, and there are fibers supplying the orbicularis oculi. There will be a faulty connection. So during closing of the mouth, there will be closing of the eyes. This is called Marcus Gunn phenomena. There will be crocodile eyes, crocodile tears. Faulty degeneration between the nerves which are supplying the lacrimal gland and there is a connection between the fibers which are supplying the parotid gland. So during eating, parotid gland, that is, it is means the supply is is coming through the otic ganglia. This is basically supplying. It is the route is like that from the inferior salivary nucleus, through which actually the glossopharyngeal nerve is coming. This glossopharyngeal nerve gives branches to the middle ear. From there, the lesser occipital nerve, lesser petrosal nerve, then that lesser petrosal nerve again comes through the mandibular foramen. Okay, foramen oval, and it will reach join with other nerve. Okay, gradually you will know, and ultimately it reaches the otic ganglia, and from there postganglionic fiber passes through the auriculotemporal nerve. Just remember the auriculotemporal nerve. Postganglionic fibers actually passes through the auriculotemporal nerve and supplies this gland. মনে না থাকে এটুকুনি শুধু মনে রাখো ওটিক গ্যাংলিয়া and inferior salivary nucleus. So, this during faulty regeneration between the auriculotemporal nerve and the facial nerve. Okay. So, there when we will try to eat, there will be lacrimation. So, খাওয়ার সময় চোখ থেকে জল পড়ছে। Regeneration, how it regenerates? It is the domain of Akash sir. Peripheral nerve regenerate হয় না? Degeneration, Wallerian degeneration and regeneration ফিজিওলজিতে পড়ানো হচ্ছে তো? হ্যাঁ, ওইটাই তো ডিজেনারেট আবার রিজেনারেট কি করে হচ্ছে? রিজেনারেশন হয় বলেই তো there is a faulty connection. And process of the functional যে process of regeneration it is the domain of physiology. Degeneration and regeneration. And you will learn it in general anatomy also. Degeneration, process of degeneration of nerve and regeneration of the nerve. Okay. In peripheral nerves, degenerates and regenerates, peripheral. আচ্ছা, বসো, তুমি দাঁড়িয়ে আছো কেন? তোমরা তো কষ্ট করে। What are the lymphatic chains you will get in the head and neck region? What are the superficial group of lymph nodes in the face and in the neck? Linear, they are present in a arc of a circle. Occipital group of lymph nodes, post-auricular, pre-auricular, submandibular, submental group,